Hey guys, Dr. Quinn Hennick here. We're going to talk about how to assess the hip joint to find an athlete's most optimal position when squatting. Should they go wide with their feet? Should they go narrow? Should they toe out? Should they keep their feet straight? We can use manual assessment to determine that. So we're not going to address pain, and we're not going to address side-to-side asymmetries in regards to rotation or flexion. This is just a general approach to hip mobility as it relates to the squat. So we take the athlete's hip, and obviously we can go into straight plane flexion. And what I'm looking for is I'm scouring in the sense that I am determining the shape of the hip socket, not trying to elicit any type of labral symptoms or anything like that, but I'm trying to find where the most comfortable and free position of that athlete's hip is. And so for this particular athlete, the hip is very mobile in this position, and I'm not super way out here to the side. And actually, when I go around her hip socket out laterally, she loses hip flexion. Whereas some athletes, their most mobile position in the hip would be way out here to the side, and then they would have the most flexion. In that case, a wider stance, maybe even more toe out, would be more comfortable for them. In this case, this athlete is probably going to have a more narrow squat position because that's where her hip feels the most free and gives me the most flexion, is in this plane. And so you just want to move around and determine the shape of the socket. And that's probably going to correlate with their most comfortable squatting position. The next thing you can look at is rotation. So if we have an athlete who's got a ton of external rotation, 60 to 70 degrees, and very little internal rotation, a narrow toes forward squat is probably not going to be the most comfortable position because they just simply don't have that within their structure. Doesn't mean you can't work to attain more mobility, but just in the moment, forcing them into that position is probably not going to be the best thing. So in this case, we've got 60 to 70 degrees of external rotation here. And we do have some internal rotation. So again, this athlete, if I'm biasing rotation and flexion, she's going to be a little bit more narrow than most and probably will be able to squat with her toes forward. So this is how we can assess the hip joint in relation to the squat, and you can combine this with tests like the quadruped rocking or simply looking at their squat and cueing wider feet, narrow feet, toes more out, toes straight, put a kettlebell in their hands and have them do goblet squats using the same cues so that they have some external support and they don't have to worry about falling backwards. And then combining these things can give you a general idea as a coach and a practitioner the most optimal position for that athlete.